My current role at Spectrum Healthcare Partners is Senior Executive Assistant. I support David Landry, our Chief Executive Officer, and Dr. Michael Quinn, President Chairman of the Board. I also support Norm Belair, our Chief Financial Officer. I joined Spectrum Healthcare Partners in May of 2008. I was working for a physician's office as an office manager, and the current recruiter at the time for Spectrum knew me through that role and asked if I would put in an application. I joined and I became the anesthesia scheduler, and then my role grew to support the practice manager and the physician leadership of that division. During that time, I went back to school to Southern Maine Community College and got my associate's degree in business administration. Every day and every week are never the same. We are in a physician environment. We are here to support them, and during the day they see our patients. So we might find ourselves, and I do find myself at times, with evening meetings. It's not every week and it's not every day, but the environment here allows us to ebb and flow. So if we work late one day, we might have a little bit of flexibility to come in a little bit later the next day, but we do have a core amount of hours that we should be here during the day. So when our physicians are working, we're here to support them. In my role supporting David and his involvement with various charities and other affiliates in the healthcare world, I do find myself communicating with other executive assistants in leadership throughout the state of Maine and in northern New Hampshire.
Hi, I'm Nikki Withrow, and I'm Integrated Marketing Strategist here at Spectrum Healthcare. I really love to feel connected to the community, and Spectrum is very giving to organizations throughout all the communities we serve. So that was a huge selling point for me, and I wanted to be able to use my creative side and be strategic. And I've worked in healthcare for years, so I wanted to stay in the healthcare realm. A typical day and week in the life of me here at Spectrum involves a lot of customer service with our clinics, our clinicians, our physicians. It is everything from signage, so patients know where to go when they enter a practice, to our social media posts and designing some of that stuff, which is really fun, and I get to use my creative brain. And then there was a lot of project teamwork within the organization, so I was able to help other departments while using my skills, which was very cool. I help manage the Scrubby squad here at Spectrum, and so Scrubby is our mascot here, and he has a squad, which is basically a kids club to help with healthy initiatives and with children in the community. And so it's all about eating your veggies and being more active and making healthier choices. And so we have a newsletter, and when we were able to go out in the community, we went out with Scrubby and we met with kids and did all sorts of fun activities. So in my role, part of the marketing team here at Spectrum is at the end of the day, it's all about the patient and patient care. The way that we get there on the marketing team looks different than when you walk into the office and see a doctor. And so we work outside in the practices on, like I said, the signage and directional signage for patients, the pamphlets you might get as a patient, even as far as what you see on your doctor's jacket when you come in to visit. But we also do some behind the scenes work. So we want to educate the community. So we do that through newsletters. We want to connect with community organizations and share our expertise in healthcare. Within the departments, we help do really specific things. We might help create a new flyer or a handout. We might be updating a website for a department, so things might be maybe easier for a patient to find on the website. So we do lots of different things. We have our fingers in everything, which is very fun.
Hello, my name is Ann Bergeron, and I'm the Talent Acquisition Manager for Spectrum Healthcare Partners. Prior to coming to Spectrum, I was working for a local hospital, a small community hospital, and so I knew that I wanted to stay in healthcare, and I knew that Spectrum was a growing company, so that's what intrigued me about joining Spectrum. So as the Talent Acquisition Manager, I am involved in a lot of physician recruitment, and so that means meeting with physician candidates, speaking with them on the phone, sending lots of email communication back and forth. And then when they come for a visit, I get the opportunity to meet with them and tell them all about Spectrum and the wonderful things that we're doing. As a member of the HR team, we collaborate together in working on benefits for the incoming physicians when they're getting ready to join. We also work on putting postings out, so oftentimes we'll work with our marketing team to get those together. We also work with our employees when they have employee relation issues or they have questions about benefits, or if a manager may need some training or some help. So in recruitment, we don't do all of those things, but we do work with our team members to get that information out to our employees. Outside of our corporate office, I also get the opportunity to work pretty closely with our managing directors, our physicians, and I enjoy that piece because even though I'm not a clinical person, I'm not helping take care of patients, I'm working with those doctors and candidates that do. So if I can have a small role in helping to bring great people to Spectrum to help our community and help our patient population, that's one thing that gives me satisfaction in my job.
Hello, my name's Kendall and I'm an IT system specialist here. A typical day for me is a lot of us are taking inbound phone calls from employees at each of our various sites. If we can't resolve it over the phone, then we might travel to their location and try to fix it.
My name's Tamara Wehrman, and I've worked at Spectrum for 15 years. I'm an MRI technologist here. Some days we scan, a good day for us would be probably maybe 22 patients, somewhere in that range. There's always a variety. There is never a dull moment in MRI because we never know what we're going to get on any given day. We scan patients. Not only do I scan patients here, but I also help get the authorizations. Whenever you have an MRI, you have to have an insurance authorization. And so I work really hard between the physicians and really pretty much all of the departments in the practice. Anybody who needs to order an MRI, a lot of the insurances need authorizations, and I take care of that piece and make sure that the physicians are getting what they need. Sort of the more my job is developing away from the actual MRI scanning piece and working now a lot with the insurances. I am working with a lot of people over there as far as kind of figuring out what we need to have for the insurances, making sure that we're living up to our end of things and kind of coordinating things. I'm trying to streamline some processes to make things easier for us, and so it's a constant give and take. Across the organization, it really has to be a team effort. Even just something as simple as getting an MRI really takes a whole crew. They've got to see a physician. There's all the staff that supports the physician in order to get the patient able to see them, and then notes are generated. I work with transcription every day, trying to get the notes that I need that I then need to mail out to the insurance offices to get the authorizations. Sometimes I'm actually going over and discussing. I'll pull physicians out of a room to actually talk with them and ask them, is there something more that I can give the insurance company to get this authorization? So it's a lot of give and take. It's a lot of fact finding. And it really is across the board. Not only do we do insurance authorizations for here, but we're also I have other parts of our practice that are now asking us to help them kind of get insurance authorizations to go for MRIs that might be going to outside facilities.
Hello, my name is Sharon Gribben. I am a radiologic technologist here at OA Spectrum Orthopedics. I first started with OA back 9.5 years ago, but not actually in X-ray because there was no position available. I did surgical scheduling, and that gave me a lot of background for the doctors, the procedures, and surgeries that were done here. And it has served me well now that I've transitioned to X-ray last year, about 1.5 years ago, June of 2019. In my role here, I do diagnostic X-rays, lower extremities, upper extremities. I also do fluoroscopy cases, which is live X-ray in the operating room suites that we have here. And I also do injection procedures, which actually take place in this room here for shoulders, hip joints, things like that need live X-ray as well. Being an X-ray technologist here, we serve a wide variety of patients in different departments here, from our joint department to spine to hand, foot, and ankle. So we're doing X-rays with all of those patients. We're bringing patients to and from the exam rooms. We interact with the medical secretaries that work here too, that do the scheduling of the appointments. We interact sometimes with the surgical schedulers. We also interact with the nurses and the physician assistants that work in the clinic as well as in the operating room and recovery room.
My name is Danielle Dunham. I am a registered nurse here in the Surgery Center. I am currently the manager of the surgery center, which includes PACU, the operating room, and the admitting area, in addition to the pre-admission testing. I had heard great things about Spectrum in the community. I loved the OR aspect of being a nurse, but I wanted to switch from the hospital. So I came to the surgery center here, and it's been a great transition. We give excellent care to the community. A typical day looks like arriving at work, making sure all departments are ready to go. The patient starts here in the admitting area. That's where we get them ready for surgery, answer any questions that they may have, ease all their fears, and make sure they're safe to go. The patient then goes to the operating room after they're admitted. They go to the operating room, and the nurse in the operating room gets them ready for their procedure, and then they go off to sleep, and then our team of surgeons comes in and fixes them up. After the patient's done their surgery, they then go to the post-operative department. There, the patient recovers from surgery. They get a snack, their vital signs are checked, we make sure they're stable, and we make sure they're feeling good before they leave our surgery center and go home. All three of the departments work very closely together to get the patient through to have the best experience. We work a lot, first of all, with everybody in the clinic here. The medical assistants, the physician assistants, and the surgeons. In addition to that, we work with the anesthesiologists, radiologists for imaging, and these are all across Spectrum sites. It's really a collaborative effort to make sure the patient gets the best care possible.
Hi, my name is Ryan Brown. I am a PT manager here in Wyndham for Spectrum Orthopedics. Typical day for me is a little different because I am the PT manager, but I'm also a practicing PT manager, so I see anywhere from 10 to 16 patients a day, plus I have all my administrative work on top of that. Yeah, not all our offices accept students, but we accept quite a few students. I think it's important to give back, and students have to start somewhere, so we take them in high school, and that's majority of schools require 40 hours of shadowing now. We take exercise science students that are trying to get into PT school, so they need a certain number of hours. They also need letters of recommendation, and then currently we have 4 actual PT students that are going through a 12-week rotation here, and that's pretty much routine, that once one group leaves, the next group kind of comes in. I think it's a good leg up, and it's a way for them, if they're truly an exceptional and good student, it's a good way for them to get a good letter of recommendation to go to schools, so I think that's extremely important as well.